Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
It's not uncommon for adults to be diagnosed with this lung disorder. Many cases of adult-onset asthma are triggered by allergies. This is according to Dr. Bruce Kirenga, a pulmonologist at the Institute.
Basically, asthma is a gene-environment interaction. In people who are susceptible, that means they have a genetic predisposition to getting asthma. When they interact with the environment, they are more likely to develop asthma.
Allergens are substances that can cause an immune reaction in people who are sensitive to them.
Allergens, these are things like pollen, things like, for example, cockroaches, things like other small organisms you cannot see, which we call dust mite. So those allergens, once they go to someone who has a susceptible genetic component, they trigger off the initial reaction, what we call the early phase reaction.
The Lung Institute at Mulago Hospital handles close to 40 patients every month, and almost half of those treated are adults.
Adult onset asthma develops in people who, mainly due to exposures, people who are exposed to environments which increase the risk of asthma, for example, pollution, dust, smoke, people who are exposed to chemicals, like in industries, cleaning agents, what we call occupational asthma.
Children with allergies may not experience asthma from exposure to allergens when they are younger. Yet over time, their bodies can change and react differently. This can lead to adult-onset asthma.
People who develop asthma when they are young, most likely it's from allergy and from genetics. That is one group. That group actually, may I say, is easier to treat. That is easier to treat asthma because most of the treatments we use to treat asthma are geared towards that group. With late onset asthma, the preponderance or the chance that these people will have asthma, allergy, is less, and those people are more difficult to treat when they develop asthma.
And the symptoms for childhood and adult onset asthma are the same.
Wheezing is the most specific sign of asthma. Cough, chest tightness, feeling like a band around your chest, and cough especially which comes during the night. During the day you are not coughing, go to sleep, but around maybe 3 a.m. you wake up coughing.
But the way one reacts to the condition differs at different levels.
There are people who have asthma, but they have very few symptoms. However, their lung function, what we call the lung function, is so abnormal, but they don't have many symptoms. There is a group that has very normal lung function, but they have so many symptoms. They are wheezing, they are coughing all the time. There are people who have asthma that needs very minimal treatment to treat. You give them small doses of treatments and all the symptoms go away. There are another 5 to 10%, which we call treatment-resistant asthma, who whatever treatment you give, the symptoms will not resolve. So in a way, the symptoms are the same, but there are differences between individuals on the amount of symptoms and the amount of impairment that they have.
There are quick relief and long-term control medications for both children and adults with asthma. Dr. Kirenga says one has to go for a thorough checkup to get the required treatment.
The definitive diagnosis of asthma is made using a test called spirometry, lung function. So in this test, what we aim at is to demonstrate that people are unable to move air as good as people of the same age, same height, same sex, and same race. So, which we call air obstruction.
If not well treated, asthma can be fatal.
The biggest problem with asthma is not air obstruction. The air obstruction is a symptom. What is causing the air obstruction in asthma is airway inflammation. Now, inflammation is a medical term which represents three things, but one of them is swelling and pain. So the airway is swollen and inflamed. That's why it blocks, and that's why it is irritable. So therefore, the hallmark of treatment of asthma is what we call inhaled corticosteroids, ICS. So any asthmatic patient should be put on an inhaled corticosteroid to remove that inflammation. Once you remove that inflammation, you'll be surprised. People used to react to dust or react to cockroaches. They see a cockroach or they are in contact with dust, the airway is not reacting because you have given the corticosteroids to control the inflammation. But what problem do we have? Maybe I need to mention this, that in most of our health facilities or most of our clinicians, they always give a bronchodilator. You come, you are not breathing, they give you a bronchodilator. The airway opens. But they are not solving the problem, which is inflammation.
Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.